Welcome to Chapter 2 of this module, which discusses in depth devolution. Prior to 2010, Kenya had a centralized system of government. What this meant was that we had a centralized system of planning and a centralized system of human resource. Everything was received from one central point. During this time, before 2010, we had a lot of bureaucratic decision-making that stretched from the community right to the headquarters at the Ministry of Health. Key features that characterized this duration of time before devolution included uniformity of interventions and the application of the theory of average. What this meant was that cities and towns like Siaya, Nyeri, Marsabit, Garissa, Nairobi all got equal portions of the same drugs, same commodities, same facilities, despite the disease burden that was in the different counties. During this time, the Ministry of Health interventions were largely informed by national aggregates, and there was a lot of generalization of interventions. Political deployment of resources was the norm, and this meant that those who were deemed to be supportive of the existing government received more resources in terms of healthcare. During this time, there was a lot of wastage due to bulk planning and unchecked impunity and corruption. One of the key features of the 2010 Constitution is devolution. Devolution has been hyped as a system of decentralization of public resources. It is widely acknowledged as a system that allows for more trickling of resources to the common citizens at the local level. This includes at the village level, at the sub-county level, and at the ward level. Indeed, Article 6 of the Constitution of Kenya recognizes that the territory of Kenya shall be divided into two parts, that is the national government and the county government. Now, the objects of devolution are enshrined under Article 174 of the Constitution of Kenya. Article 174 includes the following as the objects of devolution. 1. To promote democratic and accountable exercise of power. 2. To foster national unity by recognizing diversity. 3. To give powers of self-governance to the people and enhance the participation of people in the exercise of power. 4. To recognize the right of communities to manage their own affairs. 5. To protect and promote the interests of the minorities and marginalized communities. To promote and protect the interests and rights of minorities and marginalized communities. And again, to promote social and economic development and the provision of proximate, easily accessible services throughout Kenya. There are three key things and principles that must be adhered to for devolution to work. First is the principle of distinctiveness. Second is the principle of interdependence. And lastly is the acknowledgement that devolution can only work where there's mutual cooperation and trust between the national government and the county governments. The fourth schedule of the Constitution of Kenya distributes functions between the national government and the county governments. The schedule clearly recognizes that health is a devolved function, or rather, it is a shared function between the national government and the county governments. The fourth schedule clearly stipulates, for instance, that the national government has a two-pronged approach towards health. The duties of the national government under the fourth schedule include, number 1, regulation of national health referral hospitals, and secondly, the development of standards and policies. The same fourth schedule clearly stipulates the functions of the counties. Indeed, it indicates that the following shall be county functions. 1. Regulation of county facilities and pharmacies. Number 2. Regulation of ambulance services. Number 3. Promotion of primary health care. Number 4. Regulation of funeral parlors, crematoriums, as well as refuse disposal. And number 5, also licensing undertakings that sell food. Besides the Constitution, there are several other laws that regulate devolution. These include the Public Finance Management Act, the County Government Act, and the Intergovernmental Regulations Act. We also encourage you as doctors to also read and familiarize yourselves with Gazette Notice number 116 of August 2013. This Gazette Notice is published and expounds on the county functions which you may need to familiarize yourself with, particularly for health services. In conclusion, we can be able to objectively state that devolution offers counties an opportunity to be able to craft their own solutions related to their own health-related problems. We encourage Kenya Medical Association, its membership, and you as a doctor to be able to play a substantive role in the counties, particularly in prioritization of health as a devolved function.